I first wanted to just define what a seizure is. I felt like that was a reasonable place to start. So a seizure is defined as a transient occurrence of signs and or symptoms due to abnormal, excessive, or synchronous neuronal activity in the brain. So epilepsy is slightly different from seizures in that epilepsy is a disease characterized by an enduring predisposition to generate these epileptic seizures and are caused by neurobiological, cognitive, psychological, and social consequences of this condition. So a seizure is the event and epilepsy is the disease. The general classification of seizures and epilepsy have evolved a lot over the years. And so there's a couple of terms I know that are maybe familiar to some of you. So I wanted to provide a bit of clarification. So the first is to define a generalized seizure. So a generalized seizure is this indication of a synchronous activity that sort of spreads throughout the entire brain. And a grand mal seizure is maybe what you all were thinking is what a seizure would look like from a movie, or maybe you have a friend or a family member before your own seizure experience that you would characterize as a generalized seizure that usually involves people falling over and is tonic, clonic, sort of rhythmic movements of arms and legs. And so that would be considered a grand mal seizure or a generalized seizure. Petit mal seizures is sort of an old nomenclature that's fallen out of favor within the more recent definitions. And this is what we would often consider for children who have absence seizures, which is another term for the petit mal seizures. Again, usually true in children, and it's kind of that staring off in space that maybe you knew someone as a child who had a similar experience. So what we're mainly going to focus on today are focal or partial seizures. And these can be classified in two very distinct categories. One is complex seizures that involve loss of awareness or some impairment of consciousness versus simple seizures in which awareness is retained. And so focal seizures are what happen with brain tumor patients because we have a specific area that is generating the seizures. There are, of course, people who do have brain tumors who have pre-existing epilepsy syndromes. However, most of the seizures that we're going to be focusing on today are associated with a primary brain tumor.